Most commonly injured tendon in the body. Know what it is? Comment down below if you're watching on Facebook or if you're on YouTube catching out our video for the week. This month's video series, we talked about and started with defining what a tendon truly is. Tonight, we're talking about what the most commonly injured tendon in the body is. And then next week and the week after, we're going to talk about different levels of tendon injury, which we touched on a little bit last week. So go back and watch that. And then also how to properly treat them, which is probably the most important video out of the series of 4. Okay. Do you have any idea which tendon in your body is most commonly injured? If you do, like I said before, kind of put it down in the comments below. Let us know. We're going to talk about what that tendon is, how it happens, and why it truly happens. Okay, so let's dive right in. So, the most commonly injured tendon in the body, right? Most health professionals would think, along with kind of average Joes in the gym and weightlifters, especially strongmen and CrossFitters, it's the rotator cuff. Right, a lot of them think it's mainly the supraspinatus, which crosses right next to that long head of the bicep tendon. That's a very, very commonly injured tendon that a lot of people rupture or avulse. They completely tear, right? And they need to have surgery, usually from lifting things that are too heavy or just overuse from wear and tear over time. Especially if you're like a construction worker, maybe you're a mover, you're just using your arms and your hands quite frequently, right? And it's an overuse. Right. But the actual most commonly injured tendon in the body is going to be the extensor tendon of the wrist. Okay. And that's going to be kind of right here on this point. Most people might say, is that golfer's elbow? No, it's actually tennis elbow. Okay. That's what it's known as in the literature and from people just kind of talking about it. This is the most commonly injured tendon and it affects you and it hurts when you open your hand typically or you extend your wrist backwards. Okay. Sometimes getting into like a pull up position, sometimes a push up, landing on the ground for burpees. All those things can be really painful. All right. So how does this really occur? Most people are like, man, I've had tennis elbow for years and I can't get rid of it. All right. And I'll tell you usually why. All right. Usually it's because you're doing too much of an activity and you're exceeding your tissue capacity. Right. So your tissue, like picture like a weight scale that you stand on, right? Weight scales sometimes will cap out at 300 or 400 pounds and it just won't go over that limit. Okay. Your tendons are the same way. They have a certain scale and a certain amount of force they can tolerate. And if you exceed that force, you exceed its capacity, you're going to develop some kind of aching, some pain, because it's your body and your brain throwing signals at you to say, stop doing this activity or scale it back a little bit, or something's not right here. You're using too much of this tendon right now, and you got to calm it down a little bit, right? Back off a bit. The other thing it could be from a brand new activity. Sometimes when you pick up a new activity, like say you've never kind of played tennis before and you just started playing like 5 times a week from not playing at all, that can also lead to a lot of like pain there in that kind of tennis elbow area. And that can form a tendinopathy, like we talked about last week. And we talked about what that truly is. Or it can happen from if you're doing an activity that you are used to doing, but you're just doing it way more than normal, right? So, maybe you play tennis once a week and you've done that for a year and you just retired and now you're playing 3 to 4 times a week. So you've actually tripled the amount of time you're spending playing, right? Gripping, extending the wrist, flexing the wrist. So you end up with a lot more pain. It can happen for golf too. You would just have pain here on the inner elbow instead of the outer elbow compared to tennis elbow. Okay, that's truly kind of how it occurs. And why it occurs a little bit, we touched on for that. Usually you do too much of an activity, like I said, and it exceeds your tissue capacity. And a lot of times, what I find, guys, from just treating people in the clinic and online, mostly online, is it's from poor range of motion in the thoracic spine or the mid back between your shoulder blades, mainly from us being on these damn computers too long, right? Or just reading for too long. If you're a student, right, being on your phone for too long, if you're just out and about, right? We don't talk to people as much as we used to anymore because of these cell phones and because of all this technology. So that can affect it, but also poor range of motion at your shoulder joints as well as your wrist joint, right? A lot of people will lack the ability to move their wrist through full range of motion and extension and flexion straight forward, right? Their shoulders through flexion, it's called abduction, even reaching up above the head into this position, which is 3 shoulder motions, and then reaching behind the back, which is also 3 shoulder motions. So, being restricted with those motions can really affect what's going on at the actual elbow joint there and, can lead to more pain and overuse. All right. The other thing that can happen that I find truly happens quite frequently is weakness of the rotator cuff. So say you have tennis elbow on your right side, usually having weak rotator cuff muscles around that shoulder blade that help control and steer the joint, right? That can also affect you from overusing this elbow area, right? So if you're playing tennis or something, or you're playing golf, right, you're going to overuse these muscles because you're weak up here. So these areas are compensating and just doing all the work while these muscles aren't turning on, which are more proximal to the center midline of the body. So you really want to strengthen some of those muscle groups to help take load off of the overused tendon. That's super important because sometimes people go to therapy and they just sit there. They use these metal tools. They'll use their hands and do massages. They'll use hot packs. And it does feel pretty good in the temporary. Sometimes they'll do cupping too, which just increases blood flow to it. But at the end of the day, you have to find what's causing the issue, and that's what I usually find. It's from a tight mid back, right, restricted shoulder or wrist joint, and weak rotator cuff or mid back muscles. Okay, so make sure you address those things and you get properly assessed so you know what to do in terms of treatment and you can get rid of that elbow pain once and for good. All right. So, guys, now you should understand, what the most common injured tendon in the body is. It's not the shoulder anymore. It is now the tennis elbow, right? The extensor tendon right there on the top of the elbow. All right. Healing times can range typically from 1 to 3 months, depending on your level of injury for that tendon. But I will say tendons have a higher likelihood of healing because they're outside of a joint compared to a ligament, which is inside the joint, and the tendon's getting more blood flow than the ligaments. Okay. So thank you guys so much for watching. Be sure to like and subscribe to our YouTube channel. And remember, here at Choffner Rehab and Recovery, we help you online and we pick up where traditional PT left off with you with your rehab and recovery. And we help you as weightlifters and CrossFitters and strongmen return to 100%. All you need is a phone signal. Really simple, guys. Thanks for tuning in. We'll see you next week where we'll cover how long these 10 injuries should take to heal based on a level of injury. All right. Thanks so much, guys. Have a great night.